down here in Southern Europe.
Okay, so welcome back to Voices in Health and Wellness. This is the show where we spotlight the innovators, operators, and bold thinkers reshaping how healthcare is delivered and experienced. I'm your host, Andrew Greenland, and today's guest is someone truly inspiring in the world of preventative health and wellness. Joining us today is Martin Nielsen, founder of IAH Wellness, a cutting-edge health and wellness center based in Malaga, Spain. Martin brings a powerful blend of clinical insight, operational vision, and a deep commitment to personalised wellness. At IAH Wellness, he's building more than just a clinic. He's creating a destination for healing and preventative care that integrates advanced therapies with holistic health principles. So, Martin, thank you very much for hopping on the call today. Hopefully everything I've said is correct before we move on.
A small detail.
Okay.
We have the office in Malaga, but the clinic is based in Andorra, in the Principality of Andorra. So it's a small but little important detail.
No, absolutely. Thank you for that correction. And where are you actually calling from today?
So now I'm sitting in Malaga.
You're in Malaga.
I travel between Malaga and Andorra on a bi-weekly basis.
Okay, great. So maybe we can kick off if you start at the top and just tell us a little bit about IAH Wellness and your role in it. That'd be really helpful for people to kind of understand what you do.
Definitely. Well, IAH Wellness, it's a program or a project that we started about 4.5 years ago with the idea of trying to offer a better solution to people with Lyme infection, autoimmune disorders, and pathogenic infections that they were not getting any kind of adequate treatment in the medical healthcare. And we opened the clinic 2 years ago, and we've been ever since then modifying our treatment protocol to try to find the best solution to be able to treat Lyme patients, not only for their infection, but to rebuild our immune system. So our focus is more put on regaining and reestablishing the immune system than actually curing a disease.
Okay, that's interesting. I mean, Lyme is a huge problem over here as well. So I'll perhaps delve into that a little bit later. What about how was this all inspired? I mean, did this come about as a particular thing that particular experience, or I'm just trying to get some sense of how this clinic came about?
Well, many times things happen, and because you're in the right place or the wrong place at the right time or the wrong place. I've had my own personal health issues, like many people in this business, 20 years ago. I still today don't know if it was Lyme, but it was some kind of infection that completely shut down my immune system and my gut biome. 20 years ago, it was difficult to find any kind of information on Google. The World Wide Web was pretty new. Facebook was just starting. So I was a little bit left out there to try to find a solution. And I went through the typical healthcare system, which is the first thing you do. You visit your medical care doctor. He doesn't find anything wrong with you because physically you cannot see anything. So I was bounced between clinics and hospital for a year. And like many or the most of the Lyme patients, I got worse and worse. And I lost almost 15 kilos. But still, I was, according to all the doctors, I was as healthy as you can get. Eventually, they wanted to prescribe me antidepressant medicine. At that point, I said, no, there's got to be something wrong. There's got to be something that it didn't pop out of thin air. And I had been living for a year in Thailand, and I was mosquito bitten every single day. So I started scouting around the web as much as I could at that point. It was not easy, but I started to understand that if I could heal myself from inside, if I could reset my gut biome, if I could reset my intestinal tract, I would eventually rebuild my immune system. And I read all the information from Dr. Hulda Clark, which is a well-known herbal treatment therapist from Hungary. She deceased many years ago, but bearing in mind the way she looked at the human body, I visited a couple of laboratories in the UK and Spain. I put together my own treatment protocol, basically to clean myself and to rebuild my immune system so that the immune system could deal with anything that was wrong in my body. Because I didn't know what was wrong, but the immune system would find a solution if I could get it back. And I did that protocol for about 2.5 years. And gradually, it was not overnight, but gradually I was getting better. And by year three and a half, I was basically back to 100% of my physical strength, my physical endurance, my stamina, my skin color. So I at that point, I understood that the immune system is the key to everything. And ever since, I've always been very connected to health and wellness. It was never a business, but it was more like a hobby. And I've helped a lot of people based on my own experience. And back in 2021, no, 2020, I met my partner and we started to think about what about if we could, because he had experience with Lyme because of family members. And I have almost 20 years experience of supplementation and herbal therapy for infectious pathogens and how to use the probiotics to rebuild your gut biome. So that's, I would say at that point is when the IAH Wellness project started. And then it took us a couple of years to find the adequate place because the IPT treatment, which is our main treatment, you cannot do it everywhere. There's still limitations in EU countries. So Andorra came up as a possibility. We're outside EU. It's a small principality. We have the possibilities of performing treatments that they're not illegal in EU, but they're not legal. So they're in the gray zone. In Andorra, we're in the white zone.
Got it. For those that maybe don't know, could you tell us what the IPT treatments are?
Yeah, IPT is one of the 4 parts of our LACI protocol, which stands for Lyme and Co-infection protocol. IPT stands for Insulin Potentiated Therapy. What we do is that that comes from cancer therapy, really. What the IPT does is that it induces insulin in the cells and make the cells permeable, meaning that the cells will gradually open up, allowing us to induce the antibiotics inside the cells where almost all the infectious pathogens are located, and very safely away from normal oral antibiotics and even IV antibiotics. So it's kind of a Trojan horse. We trick the cell to open up because it's getting nutrient. What we're doing is we're sending a small package with the nutrients packed with antibiotics.
Got it. So obviously you started with your own personal health journey, and it probably took you a lot of experimentation to kind of find out your own healing journey. How has that morphed into what a typical journey might look like for your patients that you're seeing today?
It's very, very linked. I don't know how many other Lyme doctors work. I'm not a doctor, but there's no supplementation or herbal treatment or probiotic treatment that we give the patients that I haven't used myself. And that is due to all the years that I had to experiment on myself to be able to find the solution. So it's very well morphed into the treatment. Both the probiotic protocols from human origin, I've used it on myself. I've tried on family members to make sure that mainly to understand the work. When you get symptoms, why are there? What's going to happen? If you get bloating, will it disappear? So I'm able to speak with the patients, especially in video calls that we do both pre-treatment and post-treatment, and explain to them what you're feeling is normal. It will go away. It's a normal symptom. You should expect these kind of symptoms on your healing journey. So it's very valuable being able to experience this path myself.
Got it. So what does a typical day look for you at the clinic at the moment? Are you more on the operations side or direct care or in the innovation side or a mixture of all of the above? How does a typical day look like for you at the moment?
I'm not that, I would say more than the daily routine of the clinic is from a patient interest comes in, we reach out to the patient, we set up a video call with the patient because the majority of the patients are in the US. So the best way to understand the patient, to be able to ask questions, answer questions, build up a certain trust, which is very important, is by having a face-to-face. Having a face-to-face meeting physically is impossible due to distance. So we offer always a first video call consultation free of charge. Those video calls normally takes between an hour and a half and 2 hours, because once you start talking to a patient, questions start arising out of nowhere, which is normal. And the majority of the Lyme and Co-infection patients, they need someone to speak to, because it's a very common factor that no one has ever listened to them or even taken them for serious. And I've had that so many times, because I take the video calls. I take the introductory calls, and many patients break down because they've never had someone even listening to them. So it's so I usually set aside at least 2 hours for those calls if necessary. And then once a patient decides to come to Andorra, we set them up for a pre-treatment protocol. The pre-treatment protocol is 30 days before arrival. It's based on probiotic protocol and supplementation. And this allows us to gently modulate the immune system response and subtly rebuild the gut biome, which normally is non-existing. That way, when they arrive to the clinic and start the IPT treatment, which is rather harsh, the body is a little bit better prepared.
Got it.
So once they arrive to the clinic, it's a 6-week treatment, normally 3 to 4 hours a day. It's the mixture between IPT with antibiotics, IV boosting supplementation, intravenous, physical therapy, mindfulness, because a lot of Lyme patients have cognitive problems, and it's very functional to have them a couple of sessions a week on mindfulness. It helps them. So that's the normal day. Normally treatment starts in the morning. And then once the patient finishes the 6 weeks, they go back home and they still continue between 9 to 12 months on a oral supplementation, herbal therapy, and probiotic protocol that we set up for them. We personalize it, and then we have a weekly follow-up with a daily log that the patient fills in, so that we can monitor the symptoms, the ups and downs, the progress, and then every 2 weeks we have a video call until the patient says, I don't need it anymore. And that normally happens after about 20 weeks.
Okay.
So we don't leave the patient out once they finish at the clinic. I normally tell the patient, we're going to be together for a year. It is a long journey, but it took a long journey to get you sick. Now it's going to take time to get you well. And it's not going to happen overnight.
And how many patients are kind of complete everything they need to do in a year and they're better, in inverted commas, particularly for Lyme? Because I know how difficult it is to treat, because I've been involved myself.
It is very difficult, especially because where the spirochetes are located, they're all intracellular. Many patients have co-infections, which makes it even more difficult. They have activated viruses. Epstein-Barr is very typical. Herpes simplex viruses. So it's a complete breakdown of immune system. But the treatment works. It takes time. Normally, there's a change in physical condition aptitude about week 4 at the clinic. The first couple of weeks, patient don't get worse, but they do have Hirschheimer reactions. We try to modulate them as much as we can, because it's not a bad thing, and it tells us that something is happening in the body. But normally, before getting better, you get worse. It's a very common phrase. So normally, about 4 weeks in, patients are starting to feel now something is happening, and it's happening in a positive way. And by 6 weeks, we've come a large step in the treatment journey, but now it's really important that we continue. That's why this post-protocol of 9 to 12 months is so fundamental, because that's going to keep on driving the herbal treatment gradually into the cells, breaking down the biofilm. The probiotic protocol is gradually recolonizing the gut biome, strengthening the immune system, because that's where we want to go. We want to give the immune system a way back to operate the way it did before the person got sick.
Good.
So the success rate is, right now, every single patient has gotten better, a lot better. We never say cured, because once you have Lyme in your body, it's always going to be there, like the herpes simplex virus, but it's not a problem as long as the immune system can handle it. So every single patient is now back to normal life. You can have some aches here and there, still have a little bit of headache once in a while, but they've gone from wheelchair to back to active life, which is a huge gain. And then we give them the recommendation to, once you finish the protocol, there's certain supplementation you should be on for life to maintain your immune system as active and as powerful as possible. And those are just maintaining adequate vitamin D3 levels, K2, calcium, magnesium, NAC, maybe cysteine as well. So normal supplementation for a person that is active, maintaining a active life and keeping an immune system fit for basically anything.
Amazing. So we're seeing wellness and preventative care move from the fringes to the center of healthcare conversations, particularly in Europe. And what big shifts are you noticing from your vantage point in the work that you do?
Well, we have to bear in mind that there's still a huge amount of countries in Europe that are Lyme-free. They have ticks, they have mosquitoes, they have flies, they have lice, but there's no Lyme. So it's still difficult. I mean, I better say it like this: the approach to a patient after 7 years of neglected disease, it's a big hurdle. When you're telling them that we have a treatment protocol which is different, it's a long protocol, but it works. It makes you sound like a car salesman. So it's a difficult trust leap to take, both for them and for us, to be able to find an understanding that you might have been to several treatments, you might have been run around, but you should give us a chance to treat you. And that is based on the medical healthcare, where there's no knowledge, and I would say not very much interest either.
All right. What about patient expectations? Have you noticed any changes in the way patients expect the way they're going to be treated by you, your clinic? Has anything changed? Or, I mean, obviously these are quite complex patients. I guess they've always been quite demanding in a way. I don't know. How has it been from an expectations point of view?
Yeah, you said a very curious word there, demanding. Let's compare with a cancer patient. A cancer patient, I would say, I don't know if they have any expectations. I don't know if they have any demands. They go to the medical doctor. They're probably remiss to the hospital. They start treatment. They don't Google. And that's it. A Lyme patient our patients have been sick for an average of 7 years. That's 7 years of Google. That's 7 years of trying to understand the majority what's happening with me, for better or for worse. The majority have a huge amount of information. Not all of the information is correct though, but they have information. So when they come to us, their expectations are many times zero, because they've been on treatments. They have been to clinics. Every time they've had a treatment, they've gone worse. So that's the first huge step we have to try to get around, to make them understand that please try to forget the past. Let's try to look forwards. Don't look backwards. Backwards will be important once we're doing treatment, but right now we need a clear mind. So it's a big hurdle in the beginning, because their expectations are basically down to zero. I'm not going to get well, because they've told me that I should accept my disease. So yeah, it's a demanding patient, and many times a patient that expects basically nothing, and psychologically very, very broken down. And that's one of the reasons why we spend time with them. We only take 7 patients a month. Our ratio medical doctor, nurse, patient is very high. They're never ever alone. They never share the treatment room with a second patient. They're always under supervision. So we try to make them feel being taken care of. And we're seeing that that is really important. You could optimize this as a business and put 50 patients in a big room, but our philosophy is different.
Mm-hmm.
We are human beings, and we're treating with human beings that are broken down, and we need to give them attention and care.
What's working particularly well for you at IAH Wellness at the moment? What are you sort of most proud of in your approach?
I would say that having a patient coming in a wheelchair, not being able to stand up and walk for more than 15 meters, seeing them going back home after 6 weeks without a wheelchair, and getting notifications after 20 to 25 weeks that they're out walking 10 kilometers a day and back into normal life when they've been sick for 14 years. I would say that's what makes me the most happy, and that's our biggest achievement. You can't buy that for money. Giving the life back to a patient.
Amazing. Must be very satisfying seeing that kind of remarkable transformation.
Yeah, it is. It takes time. It is a struggle. You have to build up the trust. You have to get them, the majority overseas, to come over. They come normally from other medical doctors. But for me, the most important thing is that what we're telling them is true. We never say we're going to cure them, but we promise we're going to make you better. If you stick on the protocol and you do what we tell you to do, which is really important, and we have to stick to it for a long time. We cannot give up. Giving up is not an option. So patients that are really, they stick to the line, even if they don't see the light in the beginning, they eventually do. And when that transitions comes and you get feedback that I'm noticing differences. I'm noticing changes. My daughter I haven't seen for a couple of months or a year. She said, "Dad, you really look much better." Those are the small things that makes it worth keeping going.
Amazing. And on the flip side, what's most frustrating recently? Is there anything that you wish would just work better, or anything that kind of challenges you and your team in terms of what you do?
I would say it's the financial issue. It is, because these treatments are not covered by any insurance. So people have to pay them themselves. And besides being an expensive treatment, the majority of the patients have already spent almost all the money on other treatments. So one of our main tasks right now is we need to be able to get a little bit further up in the line of treatments. When a patient gets sick, don't find us after 7-10 years. Find us before you might lose your job, before you might lose your family, which even happens, because they spend a lot of money on treatments during the years that eventually didn't really work out for them. Were too short, inadequate, and not holistically set up enough. So the funding is a huge issue. I always say if we could set up a fund that could actually, like in cancer foundations, that would actually finance Lyme and co-infection patients, that would be the major breakthrough. So that the money was not a problem, because unfortunately there's a lot of patients we can't treat because they can't afford it. And it's horrible. It hurts. Because you can make a difference, but there's no financing feasible for them.
I mean,
I would say that's a big hurdle.
Yeah, absolutely. I mean, typically, what's a kind of a typical bill for a patient for the 12 months? I mean, obviously everybody's going to be different and there are variations, but just give us some sense of perspective on what the kind of bill is for a patient.
The reason why we've done it this way is that a patient needs, we need antibiotic treatment. There's no way around it. We need to kill the infectious pathogens. In a perfect world, the patient would stay 3 to 4 months at the clinic, but that's physically not really feasible. Financially, not. So we've put together a treatment protocol where we reduce the time at the clinic to make it more economically viable. And then we've expanded the whole treatment time doing it at home. So I would say that every month at home, between supplementation, herbal therapy, and probiotic therapy, is around €300 a month, which is more or less feasible for the majority. And then the treatment at the clinic is where the major cost goes. It's €11 a day for between 30 to 45 treatment days. Because the IV antibiotics is expensive, IPT is very expensive, and then the immune system IV is expensive. So there's no way, and we've tried to make it as economically reduced as possible. So if they can manage the treatment at the clinic, the home treatment protocols are more or less acceptable at around €300 a month.
And apart from, obviously, that's the financial thing from a patient perspective and your ability to treat more people. But is there anything sort of operationally which is a challenge in running this kind of service, funding aside? Because I completely get that.
Yeah. One day we might be able to crack that nut as well. Well, maybe one of the different parts is that we have to put needles during 30 to 45 days on a person. And that's not always easy. That's why we have a professional anesthesiologist at the clinic to be able to manage that part, because day one is not a problem, but once you've had a IV put in you for 1 week, 2 weeks, not always a good vasodilation, not always a well-working arterial system. So that's a challenge. And the only way we saw a way of getting around that is to having not only a nurse, but having an anesthesiologist that can handle those issues. If we have to use the legs, the foot, the hand, if we need to put in a port, we can put a port as well. So those are maybe those are the major struggles. And then you have the famous Hersheimer reactions, but they've never been a problem because we start low and we go up. So we don't get those tremendous effects from day one. So I think the main struggle could be, or challenge, is the way of being able to administer the IV for between 30 to 45 days, especially on children.
Yeah. Are there any specific metrics or outcomes that you focus on in your business or that you're working on to improve? I just wonder, when you're running this kind of operation, the things that you particularly look out for to kind of give you some sense of how things are going?
Well, right now we are working a lot with marketing, because to be able to treat more people, we need to be seen. There's no way around it. It takes time. And the Lyme world, or Lyme and Co-infection world, is a very, very closed community. I think because they've been bullied around so much. So all these Lyme group, Facebook groups, Instagram groups are extremely hermetically closed. They don't let anybody in there. And that's a challenge, because those are the patients. So the marketing issue is it's a challenge that we're working on. We're also trying to find a way of, and this is a project it goes in parallel, but being able to set up a foundation that can help and finance Lyme patients. That would be the breakthrough. It's difficult, and we still need a lot of more proof on everything. But being able to have a possibility of co-financing a patient's treatment would be I think, a breakthrough in this area.
And thinking to the next sort of 6 or 12 months, where would you like the clinic to be going forward?
Well, right now we are working on 6 patients a month. I would like it to be within 12 months at 11 to 12 patients a month. That means we have to double the clinic and we have to double the staff. But we have the possibility to do so. So that's what's in the pipeline for hope.
Amazing. If you could reach out to that number of patients, it'd be amazing. Because I know there's a huge number who need treatment across the world. I mean, I'm just dabbling into this world myself, so I do understand.
Yeah. And there are still a lot of, not that many clinics in the Occident, in Europe and the US that actually work with IV. IPT is almost non-existing. Many of the clinics that works, they use big rooms with multiple patients sitting with IV drops. It's a very different philosophy. I have a background in hotel business as well, so my approach to this project was to bring knowledge from the hospitality side to put into the clinic, so that the patient feels that from the moment they arrive in Barcelona, the way we pick them up in the transfer, if they need to lie down, we send a big car where they can lie down. If they want to sit up, we send a bigger car to sit up. The way we drive them to the hotel, drop them off the hotel, the way they take care of the patients, because they know about Lyme patients, the way we pick them up in the morning and drive them down to the clinic. We do a nutritional meeting with them. We do a physiological meeting with them. So it's more than just a patient coming for treatment. It's a health journey.
Well, it sounds like a destination from what you're saying.
We're trying to make it that way. If you're coming from far away, it doesn't have to be a necessary evil. Andorra is a magical place. It's very difficult not to sell it as a destination, as a tourist destination. It's a small country, extremely clean. There's no crime rate. There's no unemployment. It's very controlled. High altitude, green, fresh air, fresh water. So it's the perfect place for this kind of treatment to take place. And being able to take care of the patient as if they were on an ordinary wellness treatment, that's the philosophy behind it.
And if there was one, sorry, carry on.
No, and that's one of the reasons why we engage with the patients through video calls in the beginning. We're making them understand that this is more than just a treatment. You have to trust us with this, and the way you fly in and the way we take care of you. It's not just a clinic where you send a paycheck and you will come on day one. It's supposed to be built up as, like you say, it's a wellness journey. Especially because we're going to be together for 1 year.
Yeah, it's a marathon, not a sprint, as I say.
Yeah.
And if there was one major roadblock you could remove right now, what would that be? I know probably the funding thing is a big one, but is there anything else that you would like to be able to wave a magic wand and solve?
I would probably say awareness and acknowledgement to the Lyme patients. That the medical society would acknowledge that Lyme exists. It's not in their heads. And raise the awareness that this is an epidemic and it's rising. Not only because it's rising, it's because we've had it among us for so long that it's been covered as many other diseases or symptoms or syndromes. The climate has changed. The way we live close to animals has changed. The way we move into forests have changed. So the awareness is fundamental. If there could be more awareness, more knowledge, it would be easier for us as a clinic to work as well. especially the acknowledgement to the Lyme patients. They exist and they are sick. It's not in their head. And that I can hear from every single patient I speak with. And some patients even believe it. Because once you've been told something so many times by professionals, it gets to a point where you even start believing it yourself.
Martin, thank you so much for your time this afternoon. Really good conversation, really rich conversation. Thank you for sharing your journey, your story, and what you do for these patients. It sounds quite remarkable. I hope you can solve the funding issue, because I completely get it, because that is basically going to open up the gateway to be able to treat more patients. Yeah. I'm not sure it's an easy fix, but I hope you find a solution for it. But really do appreciate
giving up is not an option.
Exactly.
Thank you so much.
Thank you so much for your time. Really appreciate it.
My pleasure. Thank you.